what's cracking? Dr. Eric Smith here today, and I'm with Gio. I'm at the Redcon gym downtown, or down in Boca, I should say. And if you haven't been to this facility, it's one of the premier spots for bodybuilding and athletes like Gio, who is crushing in her field. And how long have you been training, Gio?
Oh my God, 20 plus years.
20 plus years, right. So she has a very interesting case. So if you come down to the gym, I know you'll see her training because you're also taking clients on the floor, right?
Yes, sir.
Okay, awesome. So you do contest prep as well as wellness and just overall health, right?
Yes, training, wellness, prep, dieting.
Everything. So I'm up on the second floor downtown, down in the gym, but you should check it out. I'll put a link below so you can get directly to the gym as well as a link so you can schedule with me. But let's talk about Gio and what she has going on. So what I was saying about her interesting case is that she has not really enjoyed chiropractors in the past, right?
No, not at all.
Yeah, she's not a big fan of just the pop crack that, because with somebody who's had this much experience in training and such, I don't really like to just pop crack and think like that's going to change everything. Because you have to look at it at the idea of, is the muscle tight causing the bone to be out of place, or is the bone out of place causing the opposite? So you chicken or the egg, and you want to take a look at those things. So with her, I did an initial assessment, but I'm going to show you what I'm doing. So mainly she's complaining she's had shoulder pain, and then she's also had, like, on the other side, her elbow pain, which, what can you point to exactly where in your elbow you're having pain?
Right here is the elbow, and between the two muscles right here on my shoulders.
So she's been doing some stretching and some things on her own to loosen it up, but clearly she has a bunch of muscle and such. So the goods and bads about having muscle is when it gets tight, it can push on the joint slot. So what we're going to do today is I'm going to walk through, assess her spine, see what's going on, give her a basic level adjustment because she hasn't been adjusted in a long time. And then I'm going to use the Ached Away Scraper on you today, which is one of the best tools that I really, really like.
Okay.
And it uses heat, vibration, and we're going to do that muscle scraping to break up some of the adhesions and let your body get some blood flow under to heal it. Okay? Awesome. We're not going to do her neck today. We're going to do some muscle release just to kind of get that loosened up. But for the most part, we're just going to work on her mid back and her low back because she has also obviously trains legs quite a bit and wants to perform the best she can. So lots of stiffness through there. And then squeeze your shoulder blades back for me. Good. So she can get back through there. Definitely a little restricted in there, but probably when she flexes and gets in that position, she has to push her shoulders more. So if you can kind of see the angle in what I see, she's got her clavicle coming through here, and then the rest of her shoulder going this way, and then her humerus, so your funny bone, attaching there. So if you look at the angle like that, that internal rotation is how you're actually going to hurt, like a rotator cuff. So obviously nobody wants to be in this position, and if I wanted to get her in that position and get her to tap out, I could, but I would hate after she comes after me after that. So this position and having her into that external rotation, she can feel how tight that is through her pec and chest to get there. But in terms of her sport, she wants to be able to do pulls and presses and get in that position, which is also now causes some pain. So what people typically do is move away from pain. So as she's moving away from pain, you're getting a little tingly in that arm?
Yeah, well, I'm in pain when you move it like that.
Yep, exactly. So she's in pain, feeling like that. And a lot of that is when you come out of the neck, all the nerves that go to the hand come out of the neck underneath the clavicle and around and then back through here. So if they're being pinched off here, that's your brachial plexus. And when it's pushing on there, you're going to have some weakness, and it's not good. We don't want that. So as well as it can put a lot of pressure through here. And earlier, and when I talked to her before about what's going on, I did speeds test. That's a test to see if it's her bicep tendon or what. And it was kind of a mix of her bicep tendon and probably a little bit of bursitis and such going on in her AC joint here. So
that hurts.
That right there. And you can feel just that.
Yeah, I can feel that it's swollen.
It's like stringing a guitar string. It shouldn't be like that. So let's do a few things first. Check out your spine. So if you don't mind, go ahead and lay face down for me, please. Okay. Not too far off. A little tight in the quads. How has your low back through here been? Kind of tight?
Yes, I'm tight right now and over. Actually set up an appointment for a massage like I did massage.
There you go.
Next week. I have to start doing that.
Good. So she's going to add in some muscle work as well. Kind of get in there with that. So very good. And then right through here in your thoracics. When you breathe, do you have pain through here? Okay, kind of right through there. So definitely some tissue work that we could do to work on her erectors that you could see through here. And then we can't specifically see all the back musculature here, but I would probably use that scraper on there as well. So why don't we get into just some kind of preliminary adjusting that we're going to do first, and then we'll get into your muscle work, okay? So we'll do some easy ones so you can kind of get used to it in your thoracics. Go ahead and take a nice deep breath for me and let it all the way out. Good. One more. Awesome. Good job. So as I palpate your lower back here and your SI joints, this is a little bit higher, as you might be able to see on the camera here how she's off. So she shifted and kind of rotated that way. So what I'm going to do is I'm going to adjust her pelvis and then her sacrum to kind of get that back on the side. So Gio, I'm going to have you lay on your right side and face me. So this little trust one, I promise you're not going to fall. I haven't dropped anybody at all. So we're going to drop this leg off here. Let this relax. Yeah, I do mine a little bit different. So the point of this is getting a little bit of stretch through her glutes here, letting her hamstring relax. A little bit of pressure. Let that relax. Good. Let's go to the other side. Take a leg like this, a little press down. Relax. Good. Excellent. Great job. So your thoracics move pretty well, which is good. So we can get a lot of like that motion. So we have to work a little bit more on your shoulder. That's what we're going to get into next, okay? So some of the things that I like to show you and how I'm going to use this ached away scraper. So the things I really like about this, it's powered. So I'm turning it on, and it actually is going to heat to 40 degrees Celsius. So as this is heating, I'm going to prep her for, you know, pretty much what we need to do by putting some lotion on there and then working through everything from there, okay? This does vibrate, and then if you've ever seen like Graston tools, a few different things, it's not a Graston tool, but it's pretty close to this. Making sure I heard you right. Woman gets on camera, gets a little nervous, huh? You're good, you're good. You're a star. So when you feel that,
Ooh, that hurts right there. Yeah.
So that's what I'm assessing now is let's figure out with her elbow pain, is it happening due to her forearm or is it happening due to her tricep or her bicep? Bicep comes through here, but she's pointing more toward the pain here, right? Mm-hmm. So usually what I see in people that are lifters, a lot of times when they go to grab the dumbbell or something, and if they don't pull it off the rack or maybe how they were gripping, that turn with your radius, which is this bone here, is supposed to roll over your ulna, which is this bone here. And so when that gets stuck, it doesn't move the way it should, so this muscle can get tight. Also, that muscle is the one that does this. So depending on how she was lifting and what she's been doing, it can really put a lot of pain like right through there. So what I'm going to do is we're going to just put some lotion on it. We're going to break up the adhesions, get some more blood flow in there. And what this type of technique does, called instrument-assisted soft tissue manipulation, IASTM, it starts to break up some of the adhesions. Can you feel that?
Oh, yeah.
A little warm, right?
Mm-hmm.
Because you've had this type of work done before.
Yeah, but a long time ago. Should be once a week, but I have to make more money for that.
That's right. That's right. You hear that? Potential clients, look at the expertise this woman has. Like, why wouldn't you sign up with her? The proof is in the pudding when you look this way, right?
Right.
You obviously know what you're doing. So what I'm doing is just working through some of these, what we call extensor muscles, so extensor of the forearm there. And we're just breaking that up, getting in there, and feel okay? Mm-hmm. So not too bad, right?
No.
You can definitely feel I'm scraping, but it's not painful, correct?
No, unless when you go close to the tendon, that's when
So that's where she has a lot of the inflammation,
right.
So we also don't need to push in there as much. Mm-hmm. Biggest thing, what we're trying to do there is scraping away some of the adhesions and working on the tissue. It's also telling the body, like, hey, this is an area that we need to heal a little bit more. Mm-hmm. So those of you that have seen people use tools like this and pretty much bloody their skin to look like the tone of this table, that's not always the best thing. More isn't better, and especially in a scenario like this, we don't want her to have a whole bunch of inflammation then making it so she can't lift, because then she'll use her good arm to punch me in the face. And we don't want any of that action because she's got to lift and do her thing. So doing that, kind of breaking that up is the first thing I like to do. And then we're going to do just some muscle release now that we have some lotion on here, and you can stay right there with it. So what we're going to do, and we want this to loosen up. So you're going to bring your fingers all the way up like that, and then you're going to take your hand all the way down as far as you can. So some of this is not going to be super comfortable, but hang with me. So fingers out all the way up like that. Oh. Yep, and then take your fingers down all the way. Do this 5 times all the way. Push. There's 1. Come back up. Let's go. Excellent. Good job. So the biggest thing I'm doing with that is there's a lot of the muscle here, and then it goes into the tendon that attaches right on the bone there. So instead of just chasing the pain there, I'm getting the muscle to release off the tendon so it quits pulling on the bone. If not, what will happen is you could get an avulsion fracture where pretty much that muscle will start to slowly tear off, or the tendon will start to tear off. And if it starts to tear off the bone, it's going to be painful in the phase of the tear off. It's going to be more painful as well as it starts to re-adhere. So usually what most doctors and people have probably told you, like, oh, just quit using it. And you pay your copay and get out of there, right? And never go back, right? We won't be doing that. We got some other remedies and things that we're going to do. So you get to have that arm back. Now let's go over to that shoulder. If you can kind of point directly where you... So the assessment of this, in terms of her having the pain and what we see there, kind of right there, right? But also there, and you say that's the worst, right? So her bicep tendon comes up across and attaches in there. So potentially this could be a bicep thing. So we're going to tear away and get a little bit into her bicep. But to me, what I feel like and what's going on is that in there, in her clavicle coming over to her AC joint is more where the problem is. Do this real quick. So same kind of thing. So we're going to dig in there. Has anybody done this type of work in this area on you yet?
No.
So the main thing is just been kind of stretching it, letting it heal a little bit, right?
Yeah, this is my first time having this problem.
Oh, okay.
This has been there for years, this too.
Okay.
On and off.
So some of these areas might be a little sensitive, especially when I get into the bicep over here. So the reason I'm scraping more in here is this is the belly of the muscle, and the belly of the muscle is always going to be the tender part. So usually people are going to have pain in where the belly of the muscle is, and you can see it kind of getting red as I scrape there, or where the tendon attaches into the muscle itself, which is kind of this area, or where the tendon attaches into the bone. So this is where you have most of that, and why I like this tool is that's what this edge is for. So I can really kind of dig in there and get right into that small area and break up some of the adhesion. So what they typically feel like is bumps, but with her, she's got a healthy balance of muscle and she's pretty lean. So you kind of got to work through all that before you're going to feel that tendon or the adhesions. And also, this isn't anything, again, that you need to dig into and use a lot of power or muscle into it to get her to bleed. Like, there's no point in that. So what I will be doing, those of you who are watching, main points that I want to point out is obviously getting adjusted is helpful to get the nervous system where we want. We want to treat the tissue as well as the neurological approach, spine and the joints. But I'm going to continue doing some muscle work on her with total release and such. Definitely check out some of the other videos on the Ache Away Scraper if you're interested in it, to see the different body parts you can work at. Make sure you check out Redcon Gym down in Boca, and you can come see me. You can come see Gio and sign up with her. Anything else?
No, that's it.
How did it feel so far?
You're the best.
I'm the best. Thank you so much. I'll catch you next video.